Welcome to this edition of Capitol Review. I'm your host, Matt Swenson. This is State Representative Kathy Brynaert. Welcome, Kathy.
Thank you, Matt. I'm really glad to be here today.
It's good to have you here, and it's good to have you folks tune in to Mankato to hear what's happening here at the state capitol and hear what Representative Brynaert is doing on your behalf and the two major pieces of work that you folks have to finish here at the legislature. This session is passing a Health and Human Services bill and a K-12 education bill. And let's begin by talking about this Health and Human Services proposal. I know that $1.3 billion was cut from the Health and Human Services budget last year. You're looking at making it another $150 million in cuts this year because of the ongoing deficit.
That's right, Matt. And this is really a difficult area. We really work hard to try to see that Health and Human Services isn't always bearing the brunt of our cuts, especially in these times of deficit. And that's why the first cut bills we did this session were in all the other areas. So the first third of the cuts came from other areas. Now we're finishing our budget work by looking at these two major areas of the budget. And Health and Human Services, we've worked really hard to protect nursing homes. We thought initially we might have to have a cut to nursing homes. The governor had proposed 2.5% cuts to long-term care, and we had reduced that to 1%. And now in the current version of the bill, we've even taken away that 1%, which I'm thrilled about because it's such a burden on the most vulnerable of our populations, but nursing home, our elderly, and then our long-term care, our disabled. So that's a really strong aspect to the bill that we were able to reduce that cut.
And I also know that you folks have made a real strong effort here to protect hospitals from any cuts, which is very important right now.
Well, very important. And to start with, as many people know, the General Assistance Medical Care solution we came up with did make it difficult for hospitals. They had to take on additional burden if they were going to become a community care center. So with that additional burden or uncompensated care for the very needy, we were afraid if we had to do further cuts to hospitals that we jeopardize them. And amazingly enough, our healthcare budget wizards have succeeded in moving those cuts to other arenas so that hospitals are at least protected in the short term.
And I know that a lot of this is contingent upon what happens in the Congress in the next couple of weeks. You folks are waiting on $408 million in federal money that will help prevent many, many millions of cuts that need to be made here in Minnesota.
Right. Those dollars from the federal government will help with moving many of our needy patients or insured, our lower income insured, to Medicare programs as opposed to general assistance medical care or other programs. And if we can get that match, it will relieve a lot of pressure on our budget. But the timing of that may be a problem, but we're assuming that we're going to get that match, structuring this phase of the budget that way, and we'll probably be asking some questions next week about that.
Well, I know that there's just a few weeks left of session, and this is some very, very important work. I know that this bill will be coming to the House floor next week, and then it will move to conference committee before being sent to Governor Pawlenty.
That's right, Matt. In these last 2 weeks, we are doing these major, our final aspects of the budget reduction to meet that almost $1 billion deficit, and in the course of that to address the tails into the next biennium, so that we're being as responsible stewards as possible of our taxpayer dollars.
Well, thank you for all the good work you're doing in this session. I know it's very difficult, and thank you so much for tuning in at home. We'll see you next time on Capitol Review.